This YouTube video news story further exposed National Health Service, NHS and Local Authority in Northwest London inadvertently failed to tackling inequalities as the key goal, breach the United Nations Convention on all forms against racial discrimination. In this respect, the local NHS and 8 local authority in Northwest London inadvertently failed to start tackling inequalities as the key goal, made no serious effort by challenging the area faces, failing to put the ambition by addressing them at the heart of integrated care system ICS strategy. Failure of implementing community conservation has not been set up in each borough to discuss this serious issue with residents, breach the United Nations Convention on all forms of racial discrimination and the United Nations Convention on the Right of Persons with Disability. This includes the United Nations Convention on the Right of Older Person, which they might be asked to shape the future of healthcare in Northwest London under the Equality Act under Section 6, Section 9, Section 20 and Section 149. The Chief Executive of West London NHS and Joint Senior Responsible Officer for North West London Population Health and Equality inadvertently failed to address the variation in accessing health outcomes and life expectancy between different areas across 8 local authorities areas. In this regard, each London boroughs, it's unacceptable, breaches the Equality Act 2010, the United Nations Convention on the Right of Persons with Disabilities, the United Nations Convention on the Right of Older Person, and the United Nations Convention on all forms against racial discrimination. The NHS inadvertently failed to work with local council, residents, the voluntary sector, Health Watch and others that include equality and human rights organization by implementing the key goal, breach the UN Convention on the Right of Persons with Disabilities, the United Nations Convention on all forms against racial discrimination, and the United Nations Conventions on the Right of all the people by failing to explain their past failure, not meeting people's needs in this regard. The Chief Executive of Hounslow Council and Joint Senior Responsible Officer for the Northwest London Population Health and Equality inadvertently failed to address health equality for 30 years since 1993, made no real serious progress. The local authorities and health service professional fallen short to tackling inequality as the key goal, breach the Equality Act 2010, the United Nations Conventions on the Right of Persons with Disabilities, and the United Nations Convention on all forms against racial discrimination in this respect, because which they've been paying lip service in this respect. The integrated care system ICS will need to build understanding through the first-hand sight of the resident and community by helping to identify and remove barriers to health equality across Northwest London by removing the racial structures and by getting rid of the system which is provoking white privilege. In this regard, they need to comply with the equality legislation. They need to comply with the United Nations Convention on the Right of Persons with Disability. They need to comply with the United Nations Convention against all forms of against racial discrimination in this regard.